ठीक है, so we were discussing the modalities of treatment. These are the different modalities that we will use when we are treating a patient with retinopathy of prematurity, right? Now, any child who is born preterm and has received supplemental oxygen, he must undergo screening. Screening लाजमी है in patients में. Those who have मतलब preterm age कम उम्र है 32 weeks, 33, 34, 36 weeks, low birth weight, and most importantly, they have received supplemental oxygen. These patients, they need to undergo screening. Screening is important. Screening is done at first at bone, then it's done at 3 months, at 6 months, and after that, it has regular intervals. The important thing is that screening is the best measure, best preventive measure. Afterwards, there are two therapies. Steroid therapy, it basically does the same thing as laser and anti-VEGF, however, it is not much used in these diseases. So we will have laser and anti-VEGF therapy and then vitrectomy. Now, why do we use laser therapy? What is the purpose of this laser therapy? लेजर थेरेपी यहाँ भी वही काम कर रही है, एंटी VEGF यहाँ भी वही काम कर रहा है जो डायबिटिक रेटिनोपैथी में काम कर रहे थे. To make sure that VEGF laser therapy, it destroys the tissue, it makes it anoxic. There is no vascular endothelial growth factor released, no growth factor released, no neovascularization, and all that cycle is stopped. And vitrectomy is done for a specific stage of retinopathy of prematurity. If that neovascularization is complete, if the vessels are formed and they invade the vitreous, or if invade the vitreous. Now, after this invasion, there can be a retinal detachment, there can be formation of macular holes, and all of those things. If that happens, then we will go towards vitrectomy. When we know the pathophysiology, we've discussed the treatment, the modalities. Screening is important, very essential, crucial. Laser and anti-VEGF vitrectomy for neovascularization. So based on the progression of disease, from a simple vessel, from simple vessels at the temporal part of the retina to proliferation, neovascularization, we have this progression of disease. So according to this, retinopathy of prematurity is divided into 5 different stages, right? What are those 5 stages? 4 of these are shown in this picture. Okay. Look at these pictures closely. Look at this one first. This is slide A. This is the temporal part of the retina. This is the avascular retina. This is the vascularized retina. And in picture A, we are seeing only a demarcation line. A small demarcation line between the avascular retina and the vascularized retina. This is which stage of ROP?
1.
First stage.
First stage, right? This is 1. This is stage 1 of retinopathy of maturity. So in stage 1 retinopathy of prematurity, there is just a demarcation line. Now look at this second picture. In this second picture, what we can see? We can see that this line is transformed into a ridge. Ridge का क्या मतलब है? There is an elevation which was not present in 1. The elevation हमें straight line पे या indirect ophthalmoscopy में काफी अच्छी तरह नजर आ जाती है. Secondly, at the part at the end or the peripheral part of vascularized retina, new vessels are growing. Okay? New vessels are growing. These are small tufts of new vessels over here. Small tufts of new vessels here. So small tufts of vessels along with a ridge. This is which stage?
Stage 2.
Stage 2, right? So we have stage 1 and stage 2. In the third stage, what will happen is that the vessels before the retina, the पिछला part था, peripherally central retina की तरफ जाएं, posterior pole जिसे कहते हैं, vessels which are rising over posterior pole, they are dilated and tortuous. more neovascular tufts are present. Secondly, we can see that the ridge is extending. This is a picture which appears when we see through the ophthalmoscope, indirect ophthalmoscope. Basically, there is progression or proliferation of fibrovascular tissue from this ridge inside the vitreous, into the vitreous cavity. So this stage, which includes fibrovascular proliferation into the vitreous cavity, which includes all the other findings of 1 and 2. This is stage 3. And this final image is of stage 4. Now, what is stage 4? Stage 4 आप बताएंगे क्या होता है stage 4?
Retinal detachment, partial.
Partial retinal detachment, meaning that there is fibrovascular proliferation. All of that stuff is happening at the peripheral retina. And in addition to this stuff, we have a retinal detachment. Now look closely at this picture. Why? How can this person say, or why does this image say that the inferior retina is detached? What is the difference between the superior and the inferior part?
Color,
ठीक है?
paleness.
Yes, the color and the paleness. ठीक है, you आप सही जगह पहुंचे हो सारे. The important thing is that there's a pattern, this pattern over here. You get this branching pattern, which is absent in the inferior part. It's not a high resolution picture, but this branching pattern is also present over here. These are the choroidal vessels which are present behind the retina. Okay? This is choroidal vasculature. And the retina is detached. There is either fluid or anything which is fluid pulling the retina away from the choroid, from the retinal pigment epithelium. Only those vessels which are present on the retina, they are visible. So we cannot see the choroidal vessel pattern beneath these vessels, meaning that the retina is detached. This is stage 4. And what will be stage 5? Stage 4 a partial retinal detachment, complete retinal detachment, meaning that this will be the image which we will see all around the optic disc. Complete retinal detachment means the retina is only attached to only attached at the optic disc. बाकी सारा पर्दा उखड़ जाता है. All of this is attached and it forms a sort of a funnel type detachment. These are the 4 stages of retinopathy of prematurity which you have to. Now, अभी तक हमने जो बातें डिस्कस की हैं, at which stages do you think leukocoria will be a symptom?
Stage 3.
Stage 2.
Stage 2. और लोग क्या कहते हैं? ठीक है, stage 2 में चलो डिस्कस कर लेते हैं sequentially. In stage 1 we know that there is a simple ridge, so it's a simple demarcation line. So it's blatantly obvious that there cannot be a wide pupillary reflex, because in order to have a wide pupillary reflex, something must be present behind the pupil. Okay? Now, in stage 2, we have a ridge. We have a simple ridge on the retina. We do not have any growth towards the vitreous. We do not have any other mass going towards the vitreous. कुछ भी नहीं हो रहा, सिर्फ एक जगह periphery में localized है. And we know that the periphery is not behind the pupil. So, will leukocoria be a symptom of stage 2 ROP?
No.
No, it will not be. Coming on to stage 3. In stage 3, there is neovascular proliferation inside the vitreous cavity. Now, if this neovascularization is great, yes, leukocoria can be a symptom. But what usually occurs is that if the vascularization is great, there is accompanying detachment. So stage 3 automatically stage 4 में convert हो जाती है. So if there's leukocoria can occur in stage 3, But alongside that leucocoria, if there's a retinal detachment, it becomes stage 4. And if there's a complete retinal detachment, it becomes stage 5. So leucocoria will only be a symptom mainly in stage 4 and stage 5 retinopathy of prematurity, but it can also occur in stage 3. Now, before we finish with this topic, look at these slides and pictures. Look at slide number A. What is abnormal with this? क्या नजर आ रहा है आपको?
Neovascularization at end periphery.
Yes, exactly. We see those neovascular tufts which we discussed in stage 2, right? We need to discuss kiya tha na? That neovascular tufts, they start appearing alongside the ridge. So we cannot as such appreciate the ridge, but we can see that there are tufts of neovascularization. यहाँ पे नजर आ रहे हैं हमें. This forms a demarcation. So this is at least stage 2 retinopathy of prematurity. If there was any vascular proliferation to the vitreous, this would have been stage 3. Second picture over here. We see low resolution pictures because I cannot find any better. So what do we see in this picture?
Tortuous vessels.
Tortuous vessels. That's good. We are seeing tortuous vessels. Okay. Tortuous vessels. And here sorry, tortuous vessels. घुमा के जा रही है. This is a temporal part of the retina. Can you see this ridge?
Yes.
Can you?
Yes.
मतलब रेजोल्यूशन बढ़ाऊंगा तो पिक्सेलेट होना शुरू थोड़ा दूर से देखें. So can you appreciate that there are red spots all around here? The red spots हैं. There are if red lines अगर आपको नजर नहीं आ रही तो at least there are red spots which indicate neovascularization. So this must also be at least stage 2 retinopathy of prematurity, in which we are seeing a ridge and we are seeing tufts of neovascularization. अब इससे हमें अंदाजा नहीं लग रहा है सच कि vitreous को invade किया हुआ है इस neovascular tissue ने. That is why we cannot say if it's stage 3. Now coming on to this picture. इसमें आपको क्या क्या नजर आ रहा है?
Ridge.
Dilated and tortuous
Vascular.
जो है, vessels are dilated and tortuous. ठीक है, dilated and tortuous over here. Tortuous over here. We can see a ridge. We can see that there are neovascular proliferations alongside the ridge over here. If you performed an FFA of this patient, which we do not need to do in routine clinical examinations, but if we did, you would see that there will be leakage and hyperfluorescence around these vessels. So there's neovascularization, there is a ridge. Is there anything else, anything peculiar about this image?
Hemorrhage.
Hemorrhage. Okay, there's a hemorrhage. So hemorrhage, if there's a hemorrhage, it means that this is not a dot plot hemorrhage. This is not a flame-shaped hemorrhage. This is either a pre-retinal or a vitreous hemorrhage. In either case, it means that the neovascularization has invaded or is moving towards the vitreous. So it's a sign of vitreous invasion. Now that, along with a ridge, neovascularizations around the ridge, and vitreous invasion, this is which stage of retinopathy of prematurity?
Third.
Third stage. That is the third stage of retinopathy of prematurity. Now look at this image. This is an image of the left eye. What do we see? Okay, we see a ridge. सही तरह नजर नहीं आ रही, but if we see that over here, we can appreciate the ridge. We can see that there is neovascularization around here. We can see that there's a hemorrhage inside the vitreous. So this is which stage of ROP?
Stage 3.
Stage 3 retinopathy retinopathy of prematurity. You have to remember the 5 stages of retinopathy of prematurity. Briefly reviewing this case, a patient of retinopathy of prematurity will be a young child, usually in the first 6 months of his life. He will present to you with leucocoria if he has stage 4, 5, or severe stage 3 disease. Otherwise, his history will include that he was born prematurely, he had low birth weight, and most importantly, he received supplemental oxygen therapy. On fundoscopic examination using the indirect ophthalmoscope, you will see vascular ridges, demarcations, then ridges, then fibrovascular proliferations, and detachments. These are according to this class stages of retinopathy of prematurity, the 5 stages we've discussed. So on the basis of this history and the examination finding of abnormalities at the peripheral part of the temporal retina, we will have our diagnosis of retinopathy of prematurity. How do we prevent this disease? We prevent this disease by regular screening of neonates, especially those who receive oxygen therapy, even if they're not premature. At risk जो भी बच्चा आता है उसकी screening करते हैं. Now, if the disease has severely progressed to the stage that neovascularization is happening, and we can see that neovascularization is happening, and we need to control that neovascularization, we use anti-VEGF and laser photocoagulation. If that neovascularization is severe and it has caused retinal detachment, it has caused macular holes or other complications, then we will go towards vitrectomy. So this was our case of retinopathy of prematurity. We've discussed 2 cases of leucocoria, which are most clinically important. The prof में भी आते हैं, वाइवा में यही तो पूछे जाते हैं, बाकी इतने नहीं पूछे जाते. We've discussed retinoblastoma, we've discussed retinopathy of prematurity. With this, we end retina. जो high yield topics से retina के हमने खत्म कर दिए. Next topic अभी हमने क्या करना है? You guys have to decide. इंशाल्लाह Sunday को हम next topic अपना start करेंगे. If you have any questions, you can ask right now or you can ask in the group.
ROP bilateral होगा?
ROP bilateral. Now
unilaterally manifest करेगा.
Now that's a good question. That's a very good question. ROP can be bilateral. Why can be bilateral? Because we know that the eyes, a peripheral part of the temporal retina, it develops at the same time दोनों तरफ, and oxygen therapy is generalized. सिर्फ एक आंख को supplemental oxygen नहीं जा रहा, which is causing damage. दोनों आंखों को जा रहा है. So retinopathy of prematurity दोनों आंखों में हो सकती है, और screening भी दोनों आंखों में करते हैं. You have to remember this. होता ये दरअसल कि एक stage पे नहीं होती दोनों आंखों में, meaning that one eye can have stage 3 and one eye can only have stage 1, or one can have stage 2 and another can have stage 4. But it occurs in both the eyes. It affects both the eyes, however, in different degrees. एक आंख ज़्यादा affected होगी, एक आंख कम affected होगी, लेकिन दोनों affect होंगी. Because the stimulus, the damage, what is causing the damage, the oxygen therapy, it is generalized. It is being given to both the eyes. If there are no other questions, we will end this session. ठीक है? मुझे भी डॉक्टर सिद्रा की तरह आदत डल गई है, ठीक है कहने की. अगर आप में से किसी को पता है कि डॉक्टर सिद्रा कौन है, चलो खत्म करते हैं फिर. ठीक है? टेक केयर एवरीवन.
ठीक है.
Thank you.
हाफिज़.